to Ellevate Louisiana Engage podcast. Ellevate Louisiana was founded earlier this year to empower women leaders throughout Louisiana by connecting and educating them on the challenges impacting our state with data-driven, nonpartisan solutions to make a better future for Louisiana. I'm your host, Julie Stokes, and today we'll be talking about the COVID pandemic and steps moving forward in the city of New Orleans with Dr. Jennifer Avegno, Director of the New Orleans Department of Health. Jennifer's been in her position with the city since July of 2018. Welcome, Dr. Avegno.
Welcome. Hi.
Hi. I happened to meet, and I'm going to call you Jennifer if that's all right.
Yeah,
Is that
of
okay?
course.
I'm
Of
so
course.
excited to talk to you because we met probably a couple of years ago and have kind of become friends. And when you took this new job at the city, I remember thinking, what on earth does a health director in a city do? Because and then all of a sudden, man, you're on TV every day. You've become, like, when I say Dr. Jen Avegno, like literally everybody knows who I'm talking about. You've become kind of like the authority on this, and it's really impressive. It's been really, I'm sure it's been an adventure for you as well. I'd just like to hear a little bit about you. You're just this woman that comes on TV every day and nobody knows anything about you.
Sure. It's funny, when I was when I had accepted this job, I read the city charter to figure out exactly what it was that I was going to be doing. And actually, one of the very archaic provisions in there is that I can quarantine a ship or really anything if there's an infectious disease. And I would joke with my friends that, hey, guess what? I get to commandeer ships. Never in my wildest dreams did I ever think that I would be anywhere close to quarantining ships, but here we are.
Yeah.
Well, thank you, Julie, for the opportunity. The week we had our first COVID cases was the day we were supposed to go to Baton Rouge with this group, and I was really looking forward to it. I had my dress picked out and everything, and then duty called. But
Ellevate,
I was sad to miss that, but it'll happen again. Just a little bit about me. I am a proud New Orleans native. My family has been here many generations. I think we got kicked out of France at some point real early on. So born and raised, love this city. You can't see it, but behind me is my family picture growing up. My parents live in River Ridge. I'm the oldest of 8. They adopted the other 7. So my upbringing is a little bit atypical. Any Dominican graduate in your group will recognize my last name. And yes, that is my mother who taught you. And yes, she is the most wonderful woman in the world. She taught generations of girls at Dominican. I am a Notre Dame graduate, so go Irish, and then came back after college because I realized that not every place was New Orleans, particularly the Midwest. And needed to be back with real food and real people and Mardi Gras. So have a master's in sociology from Tulane, and then decided to go to medical school here at LSU. So I'm that rare LSU Tulane hybrid. Studied at LSU, did my emergency medicine training at Charity Hospital, the last class to graduate right before Katrina. So I started my real adult work life 6 weeks before Katrina hit. ER doctors are no stranger to chaos and change and flexibility. Throughout my time and I do still practice in the emergency department about once a week. I'm on faculty at LSU in Tulane, teaching emergency medicine. It really is helpful to be on the ground and to understand health from a patient perspective, a hospital perspective, and now as a public health perspective. This job, as you said, I've only been in not quite 2 years. It was not something I had necessarily planned, although looking back on it now, a lot of my career was sort of building up to this. And so I just happened to be in the right place at the right time. And so have been doing this. What I do can mean different things on different days. Certainly right now it is running a pandemic response. But before that, the health department is incredibly broad and has programs around, maternal child health, behavioral health, substance abuse, domestic violence, gun violence, health equity, homelessness, really anything you can think of that is either directly health related or what we call a social determinant of health. That's what we're supposed to do with not a whole lot of money, but a really, really passionate, dedicated staff. So I'm really proud to be here. I'm especially proud to be here during this time. Um, and, I think being emergency medicine has prepared me greatly for this. I don't know how folks without that level of training, particularly at Charity Hospital, it would be really difficult, I think.
Yeah. Well, yeah, to jump into this sort of situation, I mean, thank goodness that you were wired for it. And I'll tell you that I've been impressed with the way you've handled it on screen. And
Thank
I
you.
mean, jumping into a whole different role constantly and so dramatically, goodness. I guess I would, what do you think are the biggest lessons, or what big lesson have you learned, or has the city learned in response to this COVID-19 pandemic? And did I mean, to some degree, it feels like even though we knew it was happening in China, it just like bam, just turned on
Right.
like a switch.
So, the great thing about the city of New Orleans, the good and the bad, I guess, is that we're no stranger to disasters. So we have a really robust infrastructure of responding to disasters. Now, most of them are tropical storm, hurricane related, obviously. But then we had a cyber attack, we've had a building collapse, we've had sewage and water board floods, we've had various other disasters that have really sort of built that muscle memory of what the teams do when they go in. So honestly, I felt like we were as ready as any other city could be. We had started planning for this in June or January. We had tabletop exercises. We were all of the mind that when this came to the United States, it would come in the form of that lone traveler who gets off the flight from China or Italy and gets into the cab and then goes to the hotel and then goes to the restaurant. And it's like the Outbreak or Contagion, those movies where you can trace it back to that one guy. So we had really, and that's really what the thinking was at the time. We didn't have better information. But the second day of cases, we got one case on the first day, two cases on the second day. I realized really quickly that was over, and we had to change our thinking right away, because the three cases that we had in the beginning were completely unrelated and no one had been on a plane. And so the ability to shift gears completely is hard if you're not practiced at doing it. It's the same with a hurricane, right? You think it's going to go one way and then all of a sudden it's going the other way and you have to completely shift your plan. So fortunately, we were able to mobilize pretty quickly. And I think that gave us an advantage over a lot of other cities who are still struggling with the response.
Well, and I mean, the whole idea that probably we had this soup of humanity out in the streets for Mardi Gras, and it probably spawned
Right.
during that time. And I mean, I don't know. I'm sure that public opinion was all over the place, but when St. Patrick's Day and all of that got canceled, it was like, whoa, this seems crazy.
Right.
But then, boom! Thank goodness we did it, because how much worse could it have possibly been? I mean,
Oh, it orders of magnitude. Oh, I had friends really mad at me and, said, well, we're just going to go out anyway. And I said, well, if you want to die, that's fine. You can go right ahead. And
yeah,
after a day or two, they saw what was happening and they really thought better of it.
yeah.
But so, I'm glad we had the opportunity to shut things down early, because the data completely bears it out that if not for that, we would have had 1,000 or more deaths, and we're nowhere near there.
Yeah, right. So, I mean, I think the big question right now, as we're flattening the curve, I feel like, I've really tried to be careful in my own approach to it and try to be somewhere in between, um, reckless abandon, which there is some of that out there, and scared to death. I
Right.
mean, I don't want to live my life in fear, but I want to take all the precautions, listen to the rules, assume that there are bright people that are, giving us ideas about and regulations about how to avoid this. But what does it mean? And I just want to clarify, to flatten the curve. And
Right.
some people might have already heard this, but I think flattening the curve is giving people an undue sense of comfort into
Right.
some degree. So what does that mean?
So flattening the curve really, really refers to when we're talking about an outbreak and being in the middle of sort of the worst of it. And for a viral infection like COVID, What we know is that it spreads when people are in close contact. So if people are doing their normal lives and it's as infectious as COVID, it's a very infectious disease, right? One infected person can infect 2 to 3 others easily with no measures taken. So we see that one infection really rapidly can lead to a lot of infection. However, when you put measures in place, when you do social distancing, when you wear face coverings, when you stay home, when you don't congregate and don't touch surfaces, and when you sanitize and disinfect, then the rate of infections, the number of infections that happen every day, start to decline. That's that curve. That's that lovely bell curve. What that does not mean is that you've eliminated the virus. We are nowhere near eliminating the virus. And it's not like the flu. All of us can have a flu vaccine, which we all should. Even if we don't, we all have some level of immunity to the flu in any given year, because the flu's been around for 100 years and all of us have been exposed to it multiple times. No one in the world has any immunity to COVID. So
Gotcha.
that we have to either all get it, it has to run its course through the population, we have to get a vaccine, or we have to have herd immunity, which means that at least 2/3 of the population has to get it so that we don't transmit it. And so a lot of people say, well, so what? Let's just let it run through the population, do its thing, and then we'll be over with. Most of the people will be fine. When you let that happen, though, the 20% of the people who get very ill, who require hospitalizations, ventilators, and who die completely overwhelm hospital systems. And then we get more deaths, and then we get doctors and nurses dying. And it's a really dangerous strategy. It's what New York really has teetered on the precipice of. And in no way in hell do we want to be there, because that means every one of us will have a loved one who suffers and dies because of those choices. So we have flattened the curve. Our infections, our daily infections, are down 95% from our peak, but the virus is still here, and it is going to be here until we all get it, we have immunity, or we get a vaccine.
And one of my closest friends in the world just got it a week ago, and
Mm.
she's been really sick. I mean,
Yeah.
her and her husband, he had his, at times had a pulse ox of 88,
Yeah.
which is really low. And yeah, I mean, I
And we
guess,
can't predict, right? I can't say if you decide to break the rules and go out and congregate, then you are going to get really, really sick. You might not, but your wife might. And yes, it does affect old people more, but I have seen plenty of 40-year-olds on ventilators. I've seen 50-year-olds who were relatively healthy die, and
yeah.
they would not have died. You can say, well, maybe some people in the nursing home would have died anyway, and that's true, but most of these folks would not have.
Yeah, no, I totally understand. I guess, I'm looking like what advice would you give to the people of, Orleans, also Jefferson, the whole state really, in terms of this? I think right now there's a range of feelings out in the community that's somewhere between, oh good, this is all over with, to then I see people that are riding by themselves in their car with their mask on. And
Right,
it's like, unless it's a rental car,
right.
you probably then, even after a few hours, don't need to do that. So what's the right answer? Where are we?
Yeah, I think we have to be slow and steady, and I think we have to be measured without going completely crazy. If you are elderly, if you have serious chronic medical conditions, you really should stay at home, because for you, the risk of even going to the grocery store, doing your daily thing, going into that retail store with your mask on is a lot higher than it is for me. So you are who we want to protect, because you should be the ones taking extra precautions. For the rest of us, and I try to lead by example, right? I go walking every morning in my neighborhood. I don't wear a mask when I go outside, because you don't have to. As long as you are not, walking with somebody next to them, jogging, sort of spitting in their face. When you're walking, you can go around other people, you can say hi from a distance, that sort of thing. If you own a business, or if you're going to a business, really everybody should be wearing face coverings, because mine protects you and yours protects me. And does it prevent COVID? Absolutely not. Is it the only thing that we need to do? Absolutely not. But it gives your employees a level of protection. It gives your customers a level of confidence that you want to keep them safe. And it's really not that much of a burden. We're not asking for a lot. Um, I try to sanitize everything without going crazy, right? I don't take everything I got from the grocery store and completely, put it in quarantine for 24 hours and then put it back in. I try to wipe things down, try to wipe all my frequently used surfaces. When I do work at the ER, I won't touch or see any of my kids or my husband before going upstairs and taking a shower. You don't have to go overboard. The thing I think is kids, if you've got kids, it's hard for them to understand depending on their age group. And mine are actually really good in understanding that, no, it's not the time for sleepovers. I know you miss your friends, but we're not ready yet for you to bring home whatever that family has and then make it work it, or bring whatever we have. We're just not there yet. It's going to happen, right? It might not happen for a couple of weeks, but we all just have to be really patient. The worst thing we could do is say, I'm fine, everything's fine, have a huge spike, and then have to shut down again. That would be economically devastating, and I think sort of psychologically as well.
Yeah, well, that very situation, with the kids, and mine have been great too. I have a senior in high school, so it's not the best situation ever, because he's graduating, and that's kind of a bummer with the situation. But my daughter was invited to go to Pass Chris and stay in a condo with 15 other kids, and I was like,
No.
I know, and it broke my heart because
And
I
it,
want her to have that life, but I was like, we're not there yet, you
right.
know.
Well, and it's not just New Orleans. Actually, New Orleans is doing a whole lot better than a lot of other places. But what we've seen time and time again, it's these innocent gatherings that are super spreader events. It's the birthday party in Connecticut where 40 people got sick and 6 people died. It's the funeral, wake where more funerals happen. It's the fitness class in South Korea where somebody was, sweating and grunting and infected 12 other people in the class, right? And it's just, these are activities that we can defer and do again when they're safe.
Right. So it brings up the issue of masks. Masks have become this big polarizing issue, and it's shocking to me on a lot of levels. I think that I don't know. I have so much of my own take on it, but I've heard everything from, when I see somebody with a mask, it makes me sick. They don't trust God. And it's like, wait a minute. There are all these people in Louisiana, 35,000 people that have gotten this, and a lot of them are amazing Christian people. So,
Right.
no. And on the other hand, I ride my bike and I walk outside and I'm by myself. So I don't wear a mask for that. What's the truth about masks?
Right. So, first I would say that there's no tension between God and science here, right? God put scientists here to help us explain the world.
Yes.
But so there's two kinds of masks, right? There's the mask that hospital workers, healthcare workers wear, the surgical mask and N95. And N95 is really the only mask that a healthcare worker should be wearing to care for a COVID patient, because it actually blocks 95% of virus particles. And that is just part of all the gear that we wear when we care for patients, because that is an incredibly high risk interaction. For you and me, that's not the kind of mask that we generally need. What we're talking about is something made out of cloth, a face covering. It could be a bandana. It could be, I've got mine that my mom, made for me in Dominican colors. It could be a shirt. It could be, I've seen towels, anything that covers your nose and your mouth. Does this block all of the viral particles? No. But when I'm wearing a mask and when you're wearing a mask, right? If I cough and sneeze, it doesn't get to you nearly as readily if you have a mask on and I have a mask on, right? If I don't wear a mask and I cough and sneeze, it can still get on your mask, it can get under your mask, right? So, and I've seen estimates all over the place, but generally, if we're both wearing a mask and we're not within 6 feet of each other, it's very, very difficult for us to transmit to one another. I hate wearing masks. I've always hated wearing masks. I don't even like to wear masks.
Horrible.
They're not fun. They're itchy. They're uncomfortable. But if I brought this home to my family and I could have prevented it, and this is a minimal thing for me to do, it's a shame that it's really been politicized. You know, it's not really taking away any rights any more than wearing a seatbelt is. I wear a seatbelt to protect me so that I don't die in a car accident. I mean, my freedom could say I don't want to wear a seatbelt, but it's really the same sort of thing. I think there are some small freedoms that are worth, you know, considering other people's needs first.
Well, I think there's two things there that I pick up on. First of all, I think about seatbelts and I think back to like, my younger years and when I was a teenager and before they were even mandatory.
Oh
And
yeah,
once they became mandatory, it's like, I don't want to wear this. And then over time,
right,
you grow used to it and you start to wear it and you're like, I wouldn't feel safe without it anymore. We
right,
don't have time for that. We don't have time for everybody to go through that growth.
right,
Unfortunately, we need people to kind of do that now.
right,
And I think the other thing that you said was that I wear my mask for you and
right,
you wear your mask for me. And I think that, especially when you look at it in the context of faith, which is important to so many people out here, and it drives a lot of how they deeply believe these things to be. I kind of think that the Jesus I know, the God that I know, would want me to protect other people
right.
just in case. So,
Yeah, it's service to others over yourself, but
right.
also helping yourself as well. It's really sort of
Yeah.
win-win.
Right, right, right. So good. Let's see, what was the next thing? Oh, return to work. So, I have a few little ventures that I have going on out there in the professional world, but one of the big company, the company that we own is Stokes and Associates. So at Stokes and Associates, we've got over 30 people. It's a nice little size office. Everybody's kind of got their own space, everybody's got their own office, so to speak. But we just implemented a return to work policy. And we have somebody that we have that does HR for us, and they implemented it, and it's like involves taking a temperature before you come in, and only having so many people in the office and wiping down everything. And I thought, and wearing a mask, and unless you're just in your office by
Right.
yourself. And I thought, first of all, for me, if I can work from home with both of my kids here off for the summer now, that's what I want to do. So it doesn't really impact me. But I think if I had to go to the office, that's so much. Is that like what everybody's doing? Is that how it is?
Yeah, I think most people are really taking this seriously, and I'm really grateful, because smart business leaders want to do what's right for their employees, and whether that's because they really care about their employees or they're afraid of liability, I don't know. I hope it's the former, but they do, and so many of us who are professional have the privilege of being able to work from home. And so if we can, we absolutely still should. My husband, Julie, he works in an office downtown. He has been at home for actually the week the first case hit, but even before the stay-at-home order, he and his office did not choose to go back because they all are getting a lot done working at home.
Yeah.
And he understands the risk to himself, as well as the more people you put in circulation, the more likelihood the virus will be to spread. But
Right.
if you are going to go back into an office, we've suggested or required a 25% occupancy, so no more than a quarter of your normal occupancy, strict sanitation, masks in common areas, and then, like you said, I'm in my office right now at City Hall, and I am the only person here. I don't need to wear a mask when I'm here because it's just me, and nobody else comes into my office. And if they do, they have their mask on, and I put mine on. So, for the professionals among us, it's easy to follow the rule. It might be a lot of rules, and it might be weird to have to wipe down everything, once a day, or wear a mask on the elevator. But it is what it is.
Yeah.
I really worry about our low-income workers who have been essential workers this whole time, who are transit operators, grocery store cashiers, clerks, who have been on the front line, who cannot distance as well, who are not subject to the 25% rule and are at high risk of getting this, and many of whom don't have paid sick leave. So they have to make the horrible choice between coming to work when they know they're sick or staying home and not getting paid and losing their job in a time of great economic uncertainty. So we really want to encourage folks to keep them healthy because they can't stay home. Let the rest of us stay out of everybody's way as long as possible and as long as we can keep our livelihoods going.
Yeah. Well, and that makes me think about a couple of the people that I'm closest to that got COVID and ended up in the hospital were from my friends in the Black community. And that just broke my heart. And to see how that struggle has been in that community, it's scary. What do you think's going on there? Is it really the people that I know? It's not really a health equity thing. It doesn't look like it because they're prosperous.
So,
What's going on there?
well, a couple of things. I think it really depends on were they in close contact. If you're in a party and there was one person, there were 40 people, right? We saw that. Even if they are people of means, maybe higher income people, health inequities are not just how much money you make in what neighborhood you live in. There is real sort of structural racism that plays a part in this, and it always has. And it's sort of interesting to me that the rest of the country is kind of waking up to this because we've been talking about this for a very long time. There's also, in many communities, significant mistrust of the government and of the medical system because they have been lied to and treated poorly. And so while we're seeing that in our Black community, we're also seeing it in our Hispanic community. Our Hispanic rates of positive tests are absolutely through the roof compared to both Black and white residents. And I think that's for a number of reasons. Many Hispanic workers are low income. They are in jobs that, construction or frontline jobs that have had to keep working. There's also more close living quarters, right?
Mm-hmm.
And they don't have access. If they particularly are undocumented, they haven't had access, or they've been afraid to come to hospitals, healthcare facilities, because they're afraid that it's sort of a trap for deportation. So we're really struggling with, and also they have to make terrible choices between going to work and not going to work because they're not eligible for many of the benefits that others are. So we're really trying hard. That's the focus of the city and the health department. Where we've brought testing, we have deliberately gone into neighborhoods that we were concerned did not have access, and made sure that not only were we testing, but we were bringing wraparound services to identify, do you have food insecurity? Do you have a young family and you need help with things for your family? Do you have behavioral health concerns? Are you having trouble getting to your pharmacy? And so we have got to be mindful of that because we cannot replicate historical inequity in this response. We've got to come out of this better than we were doing it before.
Well, and I think that's the key to growth, certainly as a person and as a community, is that you can't let a disaster leave you unchanged.
Right.
So
Exactly.
hopefully we can right some of those inequities because we all end up paying for them. Even if
Absolutely.
you're out there, even if somebody says, well, they're undocumented, they shouldn't have access to healthcare. They're out there going to your grocery
Exactly. And working on
and
your
they're
construction sites.
yeah. So,
Yeah.
right. So it really, in a situation like this, very much impacts all of us,
Right.
for sure. It's been kind of neat to me because I have actually enjoyed being able to spend the time at home with family. Honestly, I couldn't think of a better time, except for my son not getting to graduate quite yet, um, to be able to have some time home with him and with my daughter and my husband. And I've seen when I go for my daily bike ride and my daily walk around my neighborhood, and I see a different kind of community. We've all been kind of taken out maybe of our community that we're used to running around to one event and restaurants and every other place. But when I ride my bike, and some of my bike ride goes kind of behind houses, and you can see families at their dinner table and families sitting in their backyard and couples walking and neighbors talking across the streets. And you think, it doesn't seem all bad. I mean, I think we can embrace some of this, that some of us might have foregone some of the running around and replaced it with a deeper connection, on that family level. So for me, it's been kind of, I've let it be a blessing. how do you see us reintegrating? Like, how is it going right now with the numbers on our reintegrating? How does the reintegration into community, the bigger community, look like it's going? And do you think, from what you see going on right now, that it will continue to go more and more integrated, or do you think we're going to hit a road bump?
Yeah, I don't know. It's really all on us to figure that out. We peaked high and fast, as I said. If you look at our curve, 3 weeks to the day from the New Orleans stay-at-home order and the state was close behind is when we had our peak. And that absolutely fits with what we know about the virus. The virus takes 2 to 3 weeks from one person to another person to show the case. So it's no surprise that our peak came right when everybody was still circulating. And as soon as we stopped, we saw that steady decline. So that's what we're looking for. I'm mainly tracking Orleans, but we've got folks tracking all of our regional parishes, because what happens in Jefferson happens in Orleans. If a tree falls in St. Tammany, then a butterfly dies in New Orleans. So we really do all have to think about this as a regional approach. We have been on a downward slope from our peak for over a month, which is far exceeds the criteria set by the White House and everybody else. And it is a fantastic curve. But we know that with every restriction eased, we have the potential to go back up. And the question is, do we want to surge back up and put our healthcare workers and hospitals in jeopardy, or can we make this manageable? There's a reason why Orleans has stricter restrictions in phase one than the rest of the state. And I pushed hard for that. I know that affects folks economically, but we are always going to bear the heaviest burden. So while we know that the parishes around us are more liberal than we are in terms of their restrictions, any spike in that is going to show up in New Orleans. And so we really had to account for that. What I'm looking for, and we actually have a dashboard on the city website for anybody who's interested, so you can see what we're using to track. And so you will know when we do, if things are going in the right direction. We need to wait a good 3 weeks since we've lifted some restrictions, just to let the virus do what it's going to do, to let that increased circulation, see if it's going to give us a surge or not. At that point, we'll have a sense of where we are. And then we really want to see, so if it has gone up significantly, then we're going to have to try to figure out why. Was it one event? Was it everybody going to a certain place? Was it just more people out there? How can we intervene? If it's staying flat, then we want another 2 weeks or so to make sure that's real. And then we might think about loosening restrictions further. So it's really up to all of us. If everybody continues to wear their mask and socially distance and, sanitizes and doesn't go to a new restaurant every night with 6 new people every night, then we go to phase 2. If we can get to phase 2 in the summer, then it's going to give us a much clearer understanding of how schools might come back in the fall. And as the mother of 4, including 3 teenagers, my goal is for schools to come back in the fall. But if our numbers are going in the wrong direction, that's going to be really challenging. And it's not just for me. It's, there's a lot of kids for whom school is a lifeline, and really, would be seriously affected if we, in some fashion. So, you'll see that the number of tests that we're doing in Orleans and Jefferson Parish outpace almost every other country in the world. We are testing more than anywhere else except Iceland. I don't know what their deal is. More than the US, more than most states in the country. And so we are being very honest. We know how many cases we have. There's a lot of cities and states who are not doing a lot of testing, because if you don't test, you can't, you don't have a problem, right? We are taking the opposite approach. I think it's the right approach. I think that the regional leadership has been really good about this. And so you'll be able to know what we know, and you'll be able to sort of measure our progress.
Yeah, that's exciting. It brings to mind a quick question before we close, but is in the metro, and let's just take Orleans and Jefferson for the moment, is there any difference between what Orleans and Jefferson are allowing? I don't even know.
There is.
Sorry.
Jefferson is fully aligned with the governor. And I really have to commend the governor. He's been he has had a very difficult job. He has been rational. He's listened to science. I know he has a ton of political pressures, but I
Yeah.
think he's navigated him very well. I'm very grateful for what he's done. But he allowed a few things that we didn't. Number one, casinos. Number two, we've put size restrictions on churches and museums. And this doesn't really apply to many, but you can be at 25% or 100, whichever is smaller. And that's because when you're all going into a place and out of a place at the same time, if you have 300 people, it's really hard to control that crowd when that crowd is kind of milling about waiting to go out. So
Yeah.
with 100 people, you can easily go in and out. Same thing with casinos. Casinos have a lot of high touch surfaces. It's nothing but congregating. And, there's only one way in or out. You're in very close contact with the folks that you're doing. So we didn't feel like that was safe. We have some additional restrictions on gyms. We're not allowing group fitness classes. I struggled a lot with this, but we decided it was the right thing. And then right after that, CDC put out a report of number of clusters coming from fitness classes. So I was really happy that we did. And that's the main. We're asking restaurants, beauty, barbershops, anywhere you were in close contact with a customer, just to keep a reservation or an appointment system. In case when I go get my hair cut in 2 weeks, I have it and I have to tell my beautician, they just want to know who I saw, right?
Right.
So we are being a little bit more restrictive, but on the whole, we're fairly similar.
Well, and I think, that's a good point, because I think that the next thing that's going to be really in our airwaves, I think, is people talking about the contact tracing. And you're starting to hear a lot of like different political and, just opinions about how people feel about that. Well, we're out of time, but I just want to thank you. It's really been good to talk to you. Thank you for your service through this whole thing, because I know that everybody on this earth has so many opinions, and it's hard. I know how hard it is. And you do the best you can. And I really see that you're doing the best you can and trying to make sure that we make the right decisions. So thank you for that. Thank you for your leadership. We really appreciate it. And anyway, this was our first issue of what we're calling the Ellevate Engage podcast. Pretty excited about it. We're going to talk to a lot of women leaders. We'll talk to some men too. We're not going to discriminate. But I'm excited to see how maybe we can help educate people around the state and hopefully change the trajectory of our state a little bit. And thank you so much. We really appreciate you and look to talk to you soon. Thanks.
Great. Thanks for having me. Good to see your face, Julie.
You too.